For parents as teachers, McVie's landmark funding opened doors to explore new avenues of parental support. In 2014, a new affiliate was created in Missouri called Show Me Strong Families.
We've had the opportunity to show how well our core services, our curriculum, worked in distressed communities, high-needs communities.
Show Me Strong Families provides support for pregnant and parenting moms and dads, many of them teens or homeless, all of them under-resourced.
Being a part of Parents as Teachers, my goals were to, 1, get out of a shelter and get into a house. I did that. 2, get a car. I did that. 3, have stability and a home that my kids can call their own. I did that. This is my success story.
Parents as Teachers was also exploring new ways to improve its home visiting model.
Brandy, how are you?
Good, how are you?
In 2016, a partnership began with the University of Southern California Suzanne Dworak Peck's School of Social Work and Telehealth Clinic on a new, novel idea.
Parents will meet with a parent educator in the comfort of their own home using secure video conferencing technology. This is a great option for families who have complex schedules and need flexibility in scheduling, and for families who cannot access services for their children in their communities.
In 2018, Parents as Teachers was granted $1 million to pilot the use of virtual child developmental screenings.
Parents as Teachers at USC Telehealth can be there when others cannot to ensure that parents are their child's very best teacher, creating ready children and ready families.
The research continued, the technology became more refined, and the advent of virtual home visits couldn't have come sooner. On March 11th, 2020, with the world on lockdown, Parents as Teachers stepped up. As part of the Rapid Response Virtual Home Visiting Collaborative, Parents as Teachers became pioneers in the field, making their research and guidance available to peers and affiliates. Through virtual learning, home visiting never stopped, and approximately 100,000 families received continued care during the summer of COVID, when love, support, and guidance were needed more than ever. The pandemic's economic impact was especially hard on under-resourced communities and people of color. Parents as Teachers' unwavering dedication to diversity, cultural competency, and social economic development attracted the right kind of attention.
Their evidence-based, community-focused work is exactly what we had in mind at Enterprise Holdings when we began the Road Forward Initiative in 2020.
This funding would be used to provide additional resources to thousands of Black, Brown, and Native American families on a national level.
What was so important to us when choosing a partner was finding an organization that had been able to support and improve early childhood development and would be open to expanding that model even further.
Parents as Teachers did just that, with a new, first-of-its-kind initiative for Black and pregnant women in Missouri.
Parents as Teachers has certified full-spectrum doulas on staff who work with expectant moms prenatally through labor and delivery and postpartum.
This free service, through Show Me Strong Families, was created to address a systemic race issue head-on.
Black birthing people are 4 times more likely to die in childbirth and the year after childbirth. And I think finally people are saying we have to do something about it.
We received a lot of media attention around the doula program.
Parents as Teachers is offering a doula program to women, especially Black women in under-resourced communities.
Being in the New York Times, being on NBC Nightly News, CNN, MSNBC.
I believe that through all of this media coverage, interviews, that our voices will be heard and there will be some changes made.
Gains were made in 2022, especially through materials and marketing. which included a brand refresh.
We had places where people were not familiar with who Parents as Teachers was. And I think through this rebranding process, it has allowed for affiliates to take pride in this new brand.
More good fortune followed in 2023.
Yesterday, we got word that the organization received $7 million in unrestricted funds from philanthropist Mackenzie Scott.
One of the greatest things about this gift is we will be able to decide how we invest those dollars into the Parents as Teachers mission for children and families.
The first ever Parents as Teachers app was created, making it easier for affiliates to further interact with families. And Parents as Teachers took their model to Nigeria with a specific mission.
We have an exciting partnership with Washington University in St. Louis, and it's been integrating healthy eating and active living in the Parents as Teachers model in home visits, which has been shown to reduce obesity and diabetes, which are predictors of maternal mortality and morbidity. We received a National Institutes of Health grant to take Parents as Teachers model into Nigeria, an area that has high maternal mortality and morbidity rates, and we have a chance to have an impact.
For almost 40 years, a set of 4 comprehensive goals have been the backbone of Parents as Teachers' evidence-based model. This changed in 2023.
We're really excited that we've expanded our model goals to include 3 new goals of improving parent, child, and family health and well-being, improving family economic well-being, and strengthening community connectedness and capacity. The 7 model goals reflect the amazing work that's already happening on the ground. Data doesn't lie. Our evidence supports all the 7 model goals.
The first Parents as Teachers conference was held in 1992 with over 600 attendees. Today, the Parents as Teachers International Conference hosts over 2,000 early childhood professionals annually, making it the largest home visiting conference in the world. It's a reflection of our success, from serving 4 Missouri districts to over 186,000 families worldwide, and growing. As leaders in the home visiting field, Parents as Teachers will always reach for new horizons to help children develop, learn, and grow to realize their full potential. And our best days are still ahead.
Any program that reaches parents at a critical time and gives those parents a sense of being important to the child is going to change that child's future.